Unfortunately, the COVID-19 pandemic is not over. The Delta variant's high rate of transmission leaves unvaccinated people very vulnerable. We're seeing younger people and children get infected. Vaccinations are the only ways to end this virus. Vaccines are saving lives. So in the face of a public health emergency, it really was critical that we move quickly to create a safe and effective vaccine. And this was a monumental effort that was a result of several factors coming together, which drove the rapid development without skipping any of the scientific or safety steps. So first off, we weren't starting from scratch. We were building upon decades of research on mRNA technology and coronaviruses. Also, because of the urgency of the pandemic, the ability to recruit volunteers into clinical trials happened much, much faster than other vaccines that we've seen. There was also a lot of time saved because many of the bureaucratic inefficiencies were removed. And this vaccine was allowed to jump the line in front of other drugs in the FDA review process. And that saved us almost a year of just waiting. So once they were ready, the FDA started their analysis of all of the data, and they compressed the timeline by having staff work nights and weekends on parallel teams. Truly, this was a huge effort to accomplish this. Fortunately, over the last several months, the FDA has continued to review the data. They've reviewed hundreds of thousands of pages of data, and they were able to authorize their full approval of the Pfizer vaccine on August 23rd.
Being a frontline worker here at our local hospital, I hear people say, my body, my choice. Standardization of immunizations has been the normal. Healthcare workers getting the flu vaccine, childhood immunizations, kids going off to college with required immunizations. COVID vaccines should be the same. Your decisions impact others. Our vulnerable patient populations are the elderly, our children under age 12 who cannot get vaccinated, and our immunocompromised friends. The hospitals are overflowing. People who need medical care can't get it. And we're at a point where the healthcare system can't take care of even our other patients who need valuable healthcare resources.
COVID-19 vaccines are effective against severe disease and death from variants of viruses that cause COVID-19 currently circulating in the United States, including the Delta variant. According to state-level data, 90% of hospitalizations are from people who are not vaccinated.
Vaccines are the way out of this terrible pandemic and are available for anyone 12 and older. Transportation and home-based options are available.
Now is the time to work together as a community to beat COVID-19.
Still unsure about the vaccination? Schedule a time to speak with your healthcare provider.